Mr. Curtis, hi, my name is Julie. I'll be doing your exam today. Please tell me your full name and date of birth.
Stephen Curtis, 6/3/19.
Okay. The doctor's ordered a barium enema on you today. I'll be assisting the doctor with that procedure. What you're going to be doing at the very beginning is we're going to have one of our male technologists come and put the enema tip in. You should have prepped for the exam, and before we even get started, we'll take a scalp film to make sure that you're ready for the procedure. And if that looks clear, we'll go ahead and insert the tip. All the liquid in this bag will drain into you over a period of time. The doctor's going to have you roll around on the table in different positions to get the barium to coat all of your colon. And then once he's done with the fluoroscopy part of it, the live video, so to speak, then I'll be doing what we call overhead projections with you in a few different positions, and those are the images that your doctor will see. Do you have any questions before we get started?
Is it going to hurt?
It's going to be uncomfortable. Try not to bear down. You're going to feel some pressure, like you have to go to the bathroom, but don't. Okay, there's a tip in there. It has a balloon on the end of it that should prevent anything from coming out, but if it does, don't feel bad. I mean, this is embarrassing enough, but don't feel bad if something happens. I'm here for everything that you need, and we'll get this done as quickly as we can.
How long does it usually take?
Generally, you're going to have the barium in you for not more than 10 minutes. So it's pretty quick.
Where's the bathroom at?
The bathroom is this door right here, and as soon as you're done and the barium is drained out, you're going to get up and go into the restroom and evacuate the rest of the barium, and then we'll do one more picture at the very end before you leave. Okay. You can resume a normal diet after this is over with, and your doctor will get the results in a couple of days.
Well, let's get this done.
Okay. First of all, what I need you to do is lay down on your left side, facing away from me, facing the wall. Your head will be at this end. Okay. Turn onto your left side. Just cover for you. Okay. Bring your right leg in front of you. Okay, and lean forward just a little bit. Okay. At this point, this is where the technologist would insert the barium enema tip. He's in the Sims position, and as soon as the tip is inserted and the balloon is inflated, I'll call the physician in, and we'll get started with fluoroscopy. All right, Mr. Curtis, we're ready to call the doctor in. Go ahead and roll onto your back. Get centered on the table there. Okay. So at this point, the radiologist would come in. You would introduce the patient to the doctor. Make sure that everybody is wearing lead. Generally, we cannot shield the patient for this exam because the lead would be over that anatomy of interest. The doctor will tell you barium on, barium off, and you'll do that by clamping and unclamping the tube, which you learned about in your medical procedures class last semester. Once the physician is done with the fluoro part of the exam, you'll clamp the barium tube, the tip stays in the patient, and then we will do overheads. All right, Mr. Curtis, the worst part of this exam is over. The barium is in, and I'm going to take the next few minutes to do some overhead images. Okay?
Okay, hurry up.
Doing all right?
Let's get this done.
All right.
Oh my gosh. I really gotta go.
I know. Just take slow, deep breaths through your mouth. Right, so I'm centering to a 14 by 17, 40 inch SID. Now feel for your sides. Gonna center at the crest and midline. I need you to place your arms by your side, please. sure that he's straight. The crest. All right, sir, stop breathing. Okay, you can breathe. I would swap out the cassette. I'm gonna do an RPO and an LPO. So what I need you to do, sir, is bring this arm over your chest, bend your knee, and roll toward me just a little bit. That's good. This is 40 to 70 degrees of rotation. What we're really trying to do is open up the splenic flexure on this one. All right, sir, hold your breath. Breathe. Now I'm going to do the LPO position. All right, take that sponge out. Now what I need you to do is assume that opposite position. This arm over, this leg up, roll away from me. There you go. All right. Up just a little more. At the crest. This is going to be for the splenic flexure. The hepatic flexure. Okay, and you're centered just pretty much like you would be for an L spine, 2 inches medial to ASIS. Hold your breath. All right. Now what I need you to do is lay back flat on your back. We're also going to do a shot of the sigmoid colon. Generally, I would probably start with this position. It really just depends on the protocol of your clinical site. Collimation is going to be 11 by 14 on this one. And central ray is the same as it would be for an AP sacrum. So I'm going to feel for ASIS, 2 inches below. I'm midline on the body. Okay, he would hold his breath. All right, and then I'm also going to do a lateral rectum. So what I need you to do now for the last picture is roll all the way onto your left side. Come back toward me just a little bit. Okay, but slide your hips away from me. There you go. Okay. This would be on a 10 by 12, but a lot of you have direct capture in your hospitals, and so you would just collimate down. Okay.
Really gotta go.
Almost done. This time, feeling for crest, ASIS, be about 2 inches below. What I want to do is be centered right over the sacrum. That's where the balloon and the barium will be located. This is a 10 by 12 field of view. Okay, hold your breath. Okay. That's it for my overhead, sir. Let me just look at these really quick, and then I will drain that bag and you'll be all done.
Hurry.
So at this point, you make sure that all of the images are good with direct capture. Again, this is a lot more quick. And as soon as you know that the images are good and that no repeats are necessary, you would take the bag off the IV pole, set it down on the ground, unclamp the tubing, and let the barium drain back into the bag until all the pressure that the patient's feeling in their abdomen has subsided. And then you would obviously glove up, deflate the balloon, remove the tip, and then let your patient get up and go to the restroom. All right, Mr. Curtis, we're all done.